Sue Elliott, who's the director of nursing, has advised from her time in ITU. The way it will work is you will take 5 deep breaths in, and each time you'll hold your breath for 5 seconds. On the 6th deep breath, you will take it in and you will do a big cough and covering your mouth, okay? You will do this twice, and then you will then lay flat on your bed with a pillow in front of you, taking slightly deeper breaths for the next 10 minutes, because you've got to understand that the majority of your lung is on your back, not on your front. So by lying on your back, you're closing off more of the airways. Okay, so I'm going to do that now. That's one cycle. So you've done one cycle. You will do a second cycle. After you've done 2 cycles of this, you need to lay flat on your front with a pillow in front of you. Yeah? And you will take normal breaths, but slightly deeper than normal, but you're lying on your front. And please remember, the most important thing is laying in bed for prolonged periods on your back is going to close off the small airways, will increase your risk of getting a secondary pneumonia that can make your condition deteriorate much further.
The virus that I had, it felt like more of a cold than anything, headache, sore throat, some congestion in my chest, and that lasted for about 3 days, which at that point is when a fever came probably on about the 3rd day, and that's when we sort of knew that things were a bit different. It's not, a way that my body would typically react to a virus. I don't typically get, just physically was as bad as I felt. I knew that I laying in bed and really being in that supine on your back position for most of a whole day is not good for your lungs. So for me, it was to get up and get into a chair and to do some sort of deep breathing exercises. I did a little bit of yoga, which really focuses on your breath and on your breathing. And I felt like those things helped keep me physically and mentally sane.
Air inhaled via the nose will be warmed and have a smooth entry to the lungs. And then I will exhale via the mouth. Okay, let's just get straight into the breathing. Make yourself comfortable, relaxed. We're going to take 5 breaths, holding each breath for 5 seconds. And then on the 6th breath, we will release with a cough. As recommended, I will go through the routine twice. Okay, going to round 2. Now you've completed 2 rounds, go and lay down on your stomach. Use pillows if you need to make yourself more comfortable, and then breathe deeper than you usually would for the next 10 minutes, and then that's your session over. Now, regarding the coughing, Dr. Munchie says to cover your mouth, but I think this is only relevant to the people who has the virus to stop the spread of germs in your environment. Also, I think the purpose of the cough is if you have any mucus on your chest, then the cough will help get that off.